Now, there are different ways in which homeopathic prescribing can be done. We all know that if we want to understand the case in all its dimensions, then we have to have a complete data from the case. So collection of data will also determine by the time the physician takes to take the case. We see that if we ask novice to take a case, he may go on to take the case for 1 hour, 2 hours, but at the end of the case taking, the students come to us that they don't know what to prescribe. That is a problem we see when we are in our college OPDs or with the students. But a physician who is able to actually read between the lines and grasp what is important in this maze of data. Now, what is important for a homeopathic physician, how he can decide what is important, is he has to have a thorough grasp of the homeopathic symptomatology. He has to be like a goldsmith who is able to pick up the gold from all the metals or identify what is of real value to him. So it can be any category of symptomatology, right from the cause, the mental symptoms, the physical characteristics, the characteristic particular, the concomitant symptoms. Anything can be a key to open the case. And how a physician is able to identify these keys, that will determine by his analytic and synthetic faculties. Many a times what happens is we separate these processes of collecting data, doing the analysis, doing the synthesis and forming a totality. Ideally, these processes go on simultaneously in the minds of the physician. And this, with experience, a physician can become conscious of these processes. So experience can enable a physician to identify what is characteristic in the data, and he can develop the conceptual image of the patient and the disease in a very short time, which will enable him to understand what is important on which he can base his prescription. This, I would say, can be quick prescribing, which can be only possible when the physician develops an adequate conceptual framework and he knows how to apply this concept in practice.